Hello and welcome to Femme Fatale show by Helen. Today I have Dr. Ali Shamie, which he's a psychiatrist. And as we talked about before, that how important is for me mental health, how to seek help for yourself in order to become a better person. This is why I'm interviewing different psychiatrists, psychologists, nutritionists, and all these kind of people to be able to find what kind of help do we need. So let's seek out and let's go find these people so we can gain knowledge, gain help to ourselves, and smooth our journey in life. So Dr. Ali, thank you again for being my guest in my podcast. If you can please introduce yourself and let's talk about your background so my audience can just know like who are they listening to, that will be fantastic.
Thanks very much, Helen, for giving me this chance to talk to you as well as the people who are viewing these videos in the future.
Thank you.
I am very happy because of the people like yourself, second, third generation of Iranians who are becoming very involved in the social as well as family issues and interested to get people together to talk about themselves, as well as helping other people who are starting this journey.
Yes.
My journey, of course, in life started more than 80 years ago when I was born.
Oh my God.
Yeah. I was born to a family of 5 children in Tehran. I have been a psychiatrist since 41 years ago, consider since I came back in 82 to the United States. I was, of course, trained in 62 in United States to 69. I was having a medical school in Iran, which I finished. Once I finished medical school, I decided to come to the United States for training in the field of psychiatry. I knew from the time that I came to the United States, I knew that I want to become a psychiatrist. And that has a story behind it or on the background.
Interesting. Which I hope you can share it with us.
At that time, the psychiatry was not very popular. Everybody wanted to become a surgeon, just like Professor Ad. Everybody knows him. He was a really pioneer in the field of surgery, and identifying with someone successful was Professor Ad and some other doctors, Dr. Azizi and others in the internal medicine. But when I decided to become a psychiatrist, I knew that I'm getting into a field that is very dark, and there are not too many clues as to why people get involved with the psychiatric problems or what type of issues or problems we are dealing with.
So true.
When it comes to the human behavior.
Correct.
I'm very attracted and interested to learn about it. And when I decided to become a psychiatrist, I had to choose the psychiatry as my future profession. And that was very odd to other people, my friends and others. But again, that was my decision.
Yes.
When you make a decision, you have to pursue it. You have to follow it. You don't listen to other people saying, oh, this is too long, or this is too bad, or this and that. But I'm very happy today being a psychiatrist. And I'm still working as hard as I did 10 years ago, 15 years ago.
Oh, absolutely. I think like nowadays, like back then, mental health and seeking direction is like, how do you feel with your mental health? Like you will get tagged as a crazy person. You're like, Like, are you crazy? Why do you have to even just like seek help? You know, like, why even do we need to go there? Why do you need to go see a doctor? Why do you need to go seek mental health? Because that's for crazy people. That's not for normal people. That's not for smart people. You're already labeling yourself that something is wrong with you, which compared today is like, although it still is not common for everybody or all the culture or all the societies, but at least people, there is certain level of understanding that how important it is to touch our mental health, to seek out help, to seek out getting right and enough information to know what to do in order to be a better person, and is important, is as much as important to take care of our physics and our our body. Our mental health is as important, or maybe even more, because without right mind we cannot have a healthy body. We can't have like healthy lifestyle. So I am so pro like mental health. It became so important to me, because as I changed my identity, as I changed and seeked out every single PTSD that I had, every single trauma that I had, it like seeked out why I was depressed, what is the reason of the depression, I was able to help myself more and help people around myself. So back to what you were saying, yes. And then it was very I admire your courage that at the time that this subject was not even important, as important, you're like, you know what? No, I want to be a psychiatrist. This is really brave. You know, spend all these years at school to become a psychiatrist.
Well, Helen, you are really talking about the history of psychiatry, which we are now touching it.
Yes.
Part of it.
Yes.
What you said is true, that people were thinking about psychiatry as a field that does not belong to medicine. They were thinking that craziness is not belong to medicine.
Yeah.
And people were scared of this word. So, what we are talking about, craziness is not a medical word, is a colloquial description of behavior which is not acceptable. A behavior that is odd and is unusual. And people at that time that I was participating in this type of training were so ignorant. Still to this day, there are many people about psychiatry that I was curious to know what is all about this area of medicine that has to do with the function of our total person. Now, at that time, we didn't know much about the brain function. We did not know much about the brain function. We thought that something is happening in our life that we become a abnormal behavior. We get involved in abnormal behavior, which is called craziness.
Yes.
Now, craziness is not a medical word. It's a colloquial word that we say somebody is running on the street. We don't know why he's running, or perhaps
he must be crazy.
Half nude, and then trying to fly. So, oh, this person is crazy.
Crazy, I know.
At that time, we didn't know what is going on. Now we don't. If somebody takes LSD and runs on the street, we can say that's a toxic agent is causing this crazy behavior. And I became a psychiatrist later on. I found out that people can potentially do anything when they are under the influence of drugs, alcohol, fentanyl at this time, or LSD and other drugs that they might be abusing, and affect the brain system, brain function, which we don't see, but we see the reaction to those toxic. There are people who don't have a toxin from outside, but there are some toxic behavior or unusual behavior they have as a result of the internal biochemical changes or disorder what we call. If the change happens gradually from the beginning of the childhood and then appear during the adolescent years, we call it if somebody is behaving, talking to himself or talking to others, and say that he's getting messages from outside, what do you call them? Psychotic.
Psychotic? No, also
or in Farsi, we have a word for it.
No, what's the other one?
Ravan Parishi is the word for psychosis.
Okay, but there's still one more thing, one more disease that it is. Oh my God, like schizophrenia. I'm like, oh, so schizophrenia.
Schizophrenia is the name of the person who really described this illness from the beginning. But now many different names have been given to this illness, and still to this day we accept the schizophrenia as a form of psychiatric behavior, which is including two group of symptoms. We call it active or positive symptoms and negative symptoms. The group of active psychiatric symptoms are very much known by other people, that a person talking to himself, of course in the past talking to yourself, you could see from outside, but now they might be talking to a microphone in their ear, and you think that they're talking to themselves. You see it, a lot of people driving and they are talking to themselves. They're not psychotic, they're not schizophrenic, they're talking to the microphone, actually with telephone. But again, at that time, anybody who was hearing voices, talking to other people, that was not visible, or they could not see. And in the past, these people were handled by the church in the Western culture, because they thought that there is a spirit taking over their life, and that the spirit had to be taken out. And that was a specialty of the special group that they were doing that. Actually, they were beating the patients or just killing them, because they didn't know how to get rid of the spirit, which was the brain function. Now, this is the history of psychiatry. But we have come from the dark ages to the new understanding of what the brain can do to us, what brain function can do to us all throughout. Now, I can talk about it for years.
I know.
Hours. I know. But again, we are really still to this day are learning more about what psychiatry is and how brain function can affect our overall function, as well as adjustment to our life situation. Psychosocial issues are very important in our life, which is affected by our brain behavior.
I like what you said, is like the psychiatry, like this is basically translating like how our brain is functioning and translating it like with what, like the direction that we need to get help or a diagnosis or seek out like certain behavior that is arousing from the childhood or learned behavior or learned certain traumas or exposure to certain things that finally after so many years it turns to new sets of behavior or psychosis for us. So in general, where should we start? Like if someone sits there and not feeling good, and then feeling either depressed, feeling like that person knows that person needs help, but they don't even know from where to start because they don't want to seek out mental health. They don't want to seek out going see a psychiatrist. But I want you to just even start. When do you start? When do you start saying, you know what, I don't feel good? And just like when I'm bleeding and I need stitches on my hand and my arm, and I go see a doctor or I go to urgent care so they can stop the bleeding for me. I'm bleeding here. I'm bleeding. I need help. So where do you start? I want to just a little bit start from there. Then I'm going to go different style of questions. I don't know, about like a popular subject that we have here in society. And I'm going to go ask those from you.
Well, again, you're touching an area which is very important for us to know, and also very much a problem in the societies that we live. People go to emergency room for help.
Yes.
Majority of the people to go to the emergency room, which is mostly crowded nowadays, especially, is because of emotional problems. But they do not know that that's emotion that is affecting their heartbeat, or blood pressure goes up, or they cannot sleep at night, or they're anxious, they're angry, they're frustrated, they want to kill themselves. They go to the emergency room. Emergency room, what they do after several years of waiting, the doctor comes in and check their blood pressure and everything, and also take X-rays from the head to the toe, but depending on where they complain about the pain. Then they come up with the idea of, there's nothing wrong with you. Everything is okay. The person who is desperate for help doesn't know what to do, cannot sleep at night, has palpitation, has a bad ideas of thinking that their life is ending. He wants to kill himself, or she wants to really to do something to others. Mothers go and kill their children. What happens? They have major psychiatric problem, which is associated with depression and the feeling of hopelessness, to the degree that has not been understood by anybody else. When they come to me, they usually come in 10 years after the initial symptoms of their illness. Too late for many of these patients to be treated effectively, even though we have some treatment. But again, if they had come in earlier, would have been much easier to treat their illness. Now, if it's a biological illness coming from the family background, or perhaps it's not only inherited, but also trauma. You mentioned about post-traumatic stress disorder, PTSD, happens to a lot of people during the childhood, during the adolescent years, which are very critical years of development. And then later on, they have to carry this for the rest of their life. If they don't face it, they don't talk about it.
No,
Freud, we have a picture here. I can show you the picture of Freud.
We see it. We see it. Yep.
Whenever I want to smoke a cigarette or cigar, I look at this picture and say, Freud was doing it too. There's nothing wrong. But again, we all have certain behavior and personality, which is the byproduct of years of development. We haven't got it just overnight. From the birth to the time that we develop the symptoms, are years past. And we have to understand the trauma in our life, and also the good things that might be happening. It's not always negative. Good things that might be happening to give us the chance to develop more stable, or perhaps more mature, or perhaps more successful. When we talk about success, it's not just the person, one aspect of life. It's the everything together make a person to be successful in what he does.
Absolutely. I think even nowadays is like becoming more and more for the society is more and more clear. If you have enough money but you're miserable, that doesn't mean you're a successful person. It's not like, but you can have no money and you're just so grateful with life and you joy and appreciating life, then you can be a successful person. So the term of the success is changed for people. It's just as long as that you are aligned with how to create joy for yourself, how to create like day-to-day lifestyle that you can be content with yourself, that's your success.
As long as I complete what you said, as long as you are living in a society and you are living in harmony with the forces of society, which appreciate your success and also discourage you of doing things which is against of the rules of the society, or breaking the law for your own purpose.